Chronic anemia is different from acute anemia. It presents differently. When you see the clinical features of chronic anemia, patient may be asymptomatic for a very long time, usually detected during routine examination or examination for unrelated reasons. Symptoms are generally insidious and may be worsened by factors like infection or pregnancy or cardiovascular compromise. The symptoms may include weakness, fatigue, shortness of breath, dizziness, lightheadedness, thirst, sweating, angina, confusion, and sometimes, very rarely, coma. On examination, you may find pallor, there may be tachycardia. The pulses are generally good volume. You may find normal rhythm, or sometimes there are arrhythmias, there may be features of heart failure present even. There may be cardiomegaly, there may be raised JVP, dependent edema, there may be enlarged liver, there's ascites, or there may be effusion on the right side of the chest. Then look for these features which are specific to certain anemia, they may be present. For example, look for features of iron deficiency anemia. The patient may have history of dysphagia, dyspepsia, drugs causing GI ulceration, diarrhea with bleeding, that is inflammatory bowel disease, diarrhea without bleeding, that may be malabsorption. Patient may be having chronic hematuria. Hemoptysis is generally not a cause of iron deficiency, but chronic hemoptysis can result in iron deficiency. Menstrual disorders, pregnancies repeatedly, breastfeeding without supplementation, exposure to hookworm, skin rash like dermatitis herpetiformis, koilonychia, sore tongue, hair loss, weight loss, they may all suggest the presence of iron deficiency. Then look for the presence of chronic inflammatory disorders or organ failures like rheumatoid arthritis, SLE, inflammatory bowel disease, chronic renal failure, chronic liver disease. They can all be associated with anemia. Chronic hemolysis. Patient may be jaundiced, there may be splenomegaly, there may be evidence of gallstone, there may be evidence of marrow expansion, for example, the frontal bossing or the squaring of the digits. Crisis situation may also be noted in patients who got hemolytic anemias, for example, sickling crisis or aplastic crisis. Patients with megaloblastic anemia, they may have a neuropathy, they may be associated with inflammatory bowel disease, particularly Crohn and TB of the distal gut. Autoimmune condition may be associated with pernicious anemia like thyroid disorders, vitiligo, type 1 diabetes mellitus. And then look for the features of bone marrow failure. There may be coagulopathy, spontaneous bleeding, there are recurrent infections, patient may have lymphadenopathy, there may be hepatosplenomegaly. So look for these features in chronic anemia. In the next videos, we'll see the individual anemias like iron deficiency anemia or megaloblastic anemia.